bright, warm weekend 4 p.m. class. Uh, a little bit of the versatile things which GSU is trying to get on to you. So now we have started with a little bit of a paid workshop. Okay, so Raju sir, this class is regarding MS Word, Introduction to MS Word. So in this series, it's an 8-part series, and you will be getting hands-on training that Raju sir will be giving you, and then you can yourself create and organize your documents. And this will be a personal class, so it will be one-on-one attention, and you will be able to start using MS Word for your personal as well as your professional purposes. Okay. And when is this going to start? This will going to start on the 13th and it will end on the 22nd of June this year. And the batch size is really, really small. It has maximum 8 learners. 8 learners. Okay. So now the timing is at 11 a.m. The cost of this is for 10 classes, it is 700 rupees. Okay. 700 rupees for 10 classes together starting at 11 a.m. And in case you need any more information regarding this, you can send in a mail at help@getsetup.io. Okay. And one more of a paid class is coming up by Sandhya ma'am. That is again Introduction to Kathak. Okay. So Guru Sandhya ji will be teaching you the ancient Indian classical form of Northern India. And this is again a smaller batch so that you can be introduced to the nuances of footwork in Kathak, hand gestures, essential postures, as well as gharanas of Kathak. Okay. So this is a very, very small batch for you to get individual attention. It's a batch only of 10 learners and the duration again is 8 weeks. It will be from Monday to Thursday and it is evening time 6 to 7 p.m. Okay, 6 to 7 p.m. And for more information, you can contact the support team regarding the pricing of this. You can ask help@getsetup.io. Okay. So today we are going to deal with constipation and digestion camp. Constipation and digestion. Okay. And a little bit of an introduction regarding this is a medical camp. That's why. So knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize it, and then how to go about getting the right kind of treatment. By this, I mean, I will be giving you the basics understanding of constipation and a little bit of the digestion camp, but that does not mean that you go and get over the counter pills or, self medicate and self treat yourself. I'm not equipping you like a doctor. So do consult the doctor. But my aim here is that you pick up the diseases in the first stage so that you nip it in the bud and do not allow it to go into the last stage. That is, do not have a snowball effect when the disease is incurable. Okay. So this is my main aim in these medical camps, is that you learn to recognize your disease and then go about it. So what are the objectives of today's class? So we need to understand that constipation most commonly occurs when the waste or the stool moves very slowly through the digestive tract and it cannot be eliminated effectively. Many times, what we think that today maybe I have not passed motion in one single day and I call myself constipated. No. So in today's class, we are also going to understand the definition of constipation. Okay. So sometimes it is that you are not constipated, but the stool is not being able to be eliminated effectively. Little you can eliminate, the other is remaining in your intestines, in your rectum. That again can be constipation. Sometimes the stool is very, very soft ahead and the latter portion is hard and then we are constipated. So there are various types of constipation. Okay. The stool becomes hard and difficult to pass. The causes, we need to understand that they can be from medication. Some medications also cause constipation. Like if your stool is black in color, that means you have been taking iron tablets. Okay. And then there is lack of exercise, not enough fiber or liquid in the diet. We suppose we are not taking too much of, we are having a lot of cooked food, we are having a lot of non-veg and a lot of acidic food, that also leads to constipation. Here we must understand that why they have written not enough fiber is that fiber acts like a broom. Okay, like a broom, like a jhadu. So fiber just will clean up. It acts like jhadu pocha, it will clean up your intestines. That's why it is very important that you have your raws as well as your fruits. IBS here means irritable bowel syndrome. this is a disease wherein you swing from constipation and you swing from constipation to diarrhea. It can be just switching from diarrhea to constipation. There can be also abuse of laxatives. What is the meaning of abuse of laxatives here? It means that suppose you have started on Kayam Churna. You read in the newspaper Kayam Churna. Then it becomes Kayam. Kayam means forever. You have to keep getting that, keep taking that laxative. Otherwise, you do not get a good bowel movement. Okay. Now, changes in habits of lifestyle, such as pregnancy and in old age. This can also lead to constipation. Here, I would also like to mention one another terminology, which is known as traveler's constipation. What do you think is traveler's constipation? You go to another city and then maybe it's your sister's house, okay? You're very comfortable, but then because it's a different change in the different washroom, in the different water and food, you start getting constipation. So this is something which is known as traveler's constipation. Once you're back to your place in your house, you will again get proper bowel movements. Okay, so we need to understand that it's not just pregnancy and old age. There are many other factors also which can lead to constipation. And in case you're struggling with chronic or obstinate constipation, obstinate is very ziddy, then and no remedy working, tired of popping in laxatives and you don't know what to do, then this is certainly the right class for you. Okay, so what can be the symptoms? To get diagnosed as constipated, the bowel movements have to be fewer than 3 times a week. What is the meaning of this? Suppose you visit the cloak very fewer than 3 times a week. Okay, then you can label yourself as constipated. The secondary symptoms of constipation can be a lot of sluggishness. You feel you have not had a good evacuation, so you're very sluggish and very complacent and lethargic the whole day long. And you can also get a bloated feeling because sometimes even the gases are not eliminated. And then you can be having a lot of pain because of the gases moving around, because of that intestinal overload. You feel the stool inside has become very stony and hard and it's feeling heavy, and that can cause a lot of abdominal pain. Yeah, so this is again a very favorite slide of mine. Come closer and read it. The eyes are our windows to the soul. Our poop or our stool is the window to our health. Very important. Okay, because I had even read somewhere that they had mentioned the shape of the stool, whether the stool floats on the water in the pot or it sinks, whether the stool is having porous. So everything, it may sound very ugh and this thing, but everything indicates a disease. The sticky stool also indicates another disease. Okay, the well-formed stool, the watery kind of stool, everything, indicates some form of a disease, and the doctor can make out from your stool what kind of, the pathologist especially can make out, the MD pathologist, not the DMLT ones who just check the stool culture. So it is important that the poop is the window to your health. They say, the eyes tell you how the person is. The people who are guilty are not, will never do eye to eye contact with you. Similarly, our stool is also so very important. Okay, making sense? Anybody has a quick question? I do not mind taking it. We need to firstly understand that there is something known as an intestinal emptying time. So what is the intestinal emptying time? So there is a time, something like a circadian rhythm. There is a time for everything. Okay. So the intestinal emptying time is from 4 to 6 a.m. in the morning. Okay, so usually what should happen, that if you are awake at around 4 o'clock, 5 o'clock, and maybe you go to visit the washroom and then you come back and sleep, it's okay. But you're awake, you're going to the kitchen, maybe you've forgotten to bigao, soak something, and then you spend some more time there, maybe around 5 minutes. and then you're walking around the house, that time you should be getting a bowel movement. Okay, so as in Hindi it is always said, पेट साफ सब बीमारी माफ. Okay, so what does this mean? Is that you intestinal emptying time. That means for the stool to be formed, it takes 24 hours. So suppose you have evacuated your bowels today at 6 a.m. Tomorrow 6 a.m. again you will get nature's call. Okay, but intestinal emptying time is from 4 to 6 a.m. If you get up after 6 a.m., it's not a great idea because the intestinal emptying time is over. Okay, another thing is what I would like to mention is that the digestion or the elimination time of the body, that was the intestinal emptying. Okay, but the body, the whole body has a time. Okay, so again the body's excretory system or elimination system works till 12 p.m. Okay, and then there is the digestion time from 12 to say around 6, like that the body has specific timings. So what happens is that if you think that I will eat breakfast, okay, so suppose at 8 o'clock, 9 o'clock, whatever time, I have heard of people who have two breakfasts also. If they wake up early, they have second breakfast also, which is not a great idea. Okay, so what happens? Suppose you start eating breakfast, then the body gets the signal that I have eaten, so the digestion process automatically starts. Yes or no? The digestion process starts. Now, because the digestion process starts, the elimination process stops. Okay, so this is one homework you can do. The maybe tomorrow morning or something till 11 or till 12 p.m. Okay, start having fruits. Just starts having fruits. So I told you fruits have fiber that acts like a broom. It pushes all your excretory system waste products ahead into the rectum, and then you will, suppose you had a good bowel movement, but you've still had your smoothies, you've still had your fruits, maybe a papaya, maybe a guava, maybe a banana, and you'll second time go for stools because that is still the intestinal emptying time, and because of the fruits your waste matter has been pushed forward. Okay, but what happens is if you start having breakfast, the digestion process starts and the elimination process stops. It's given a full stop. Okay, so people who are constipated can try this. It's a good idea to be doing that. Okay, and after that, suppose you are very, very hungry and you're not used to breakfast, just go raw and just go on fruits till 11ish. You can certainly pull on till 11ish. After 11, what you can do is have a brunch or have an early lunch. Have an early lunch, even your chapati bhaji, whatever, at 12 o'clock. Then see how your system changes. Okay, now this happens because the intestines are, especially the small intestine, is 26 feet long. Okay, it is made into curls and twists and convolutions, and it is put in between of the large intestine. So the large intestine is the ascending colon, transverse colon, and the descending colon. In between that, this whole 26 feet is all folded and put there. But actually, I do not know why it is called small intestine, because it's really long. It's 26 feet. Okay. And this takes, the food takes that much time to go inside. That's why it takes 24 hours to digest your food. Okay. This is what you need to clearly understand. And what happens is most of the absorption of the nutrients, all the good products is done in the small intestine. Okay, all the absorption of the nutrients, chemicals, minerals, everything is done in the small intestine. That is why the pancreas, we think that the pancreas only insulin. That's a myth. Okay, so pancreas has a lot of other digestive enzymes. Okay, the pancreatic amylase, the pancreatic lipase. Now that's the reason the pancreas is placed very, very close to the end of the stomach. Okay, where the stomach ends, and it is very close to the place where the small intestine commences, because there is the process of digestion which is happening and absorption which is happening. So what do you think is the large intestine doing? The large intestine, the function is to again absorb water. Once the absorbed water is absorbed, that is the nutrients in the small intestine. Once the water is absorbed, then the stool becomes solid form. That's why the large intestine holds that fluid, holds the stool which is in the well-formed stool in the solid structure. Sometimes when we have diarrhea, okay, why do you think diarrhea happens and why do you think constipation happens? So if there is a lot of watery stool and then there is hyperperistalsis. So what is peristalsis? Is the contraction. Now this body does not have a motor system. The body does not have an electrically operated motor system. Everything functions on what? On contractions. This area contracts, this area releases. This area contracts, this area releases. This is the way even the food is propelled forward, even the stool is propelled forward. Okay, through this circulatory system, which I told you, was that it's transporting everything even to the brain. But this is again a tubular structure. So this is the way everything proceeds forward. So this is known as peristalsis or contraction. So if there is hyper or too much peristalsis, that means you will get a diarrhea episode. This happens when there is a bacterial infection, botulism, like you have had some food which you have, it's not suiting you. So it starts becoming what? Infection, and then you start having diarrhea when you are allergic to antibiotics. You, the doctor has, you have undergone an operation and the doctor had to give you, and then you just burst out into an episode of diarrhea. That is again hyperperistalsis. So again, opposite of that is what? Constipation. And constipation is what? It is low peristalsis. So there is hypo, you can say. There are peristalsis, the contraction is not happening only, and that's why the stool is there only, stuck there only. Sometimes what happens is that the stool is soft. The one place in the position in the intestine, the stool has become very hard, like a pellet or a stone. Then here comes the work of these massage people. There are some doctors also who are trained in this therapy. The yoga also people are trained in this therapy. They can really apply pressure in the abdomen in those areas, set that hard stool into motion, and then obviously the earlier stool is soft, so then you are getting relief from that constipation. Okay, so this is a common thing, that hardened stool. How do you think this stool becomes hard? When we procrastinate the need to go for evacuation. So never ever, never ever evade nature's call. However important it is, this is very, very common in ladies. They will go to the washroom. Oh, no, 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 this is not good. I will go home. So they can, I do not know how they can manage. I do not know how they can control. Then they'll see another 2, 3 toilets also. And then if it's not very fastidious and clean, and they will not, but then you don't know that you are causing real problem to your gastrointestinal system. Ask yourself if you've ever done that. Okay. Now, in this stage only, suppose the call was so severe, would you ever think if the toilet is great looking or not? The call was so severe, you would go, right? Other than soiling your clothes. So, very, very important that we need to understand all this. Okay, so what can be the causes of constipation? The medications I have discussed. Mental stress can be a cause of constipation. Lacking fluids, again lacking fiber. You will see people drinking a lot of water, still they will be constipated. Okay. Now sugar also causes constipation. Surgeries, after surgery, if you are bedridden due to any reason, you may not be very old, still because there is no mobility. Okay, no mobility, you can suffer from a constipation attack. And there can be overuse of laxatives. Now here, let me just tell you one thing. Overuse or abuse of laxatives means laxatives have something known as senna. SENNA. Okay. So in case you're on the phone, you can really go quickly and see what is senna. It is a leaf, a herb. Now senna, what does it do? You're very happy. It has given you a great stool. But then what happens later on? Senna causes lazy bowel syndrome. What is lazy bowel syndrome? Yes, we can personify the bowels also to be lazy. There is again low motility, low peristalsis, and then you get constipation because these are again habit forming things. Mental stress also very, very important point that can cause lack of exercise, lack of fiber, and certain eating disorders. Not discussing the the bulimia and the anorexia nervosa, but certain eating disorders are also associated with constipation. Certain neurological disorders are also associated with constipation because neurological, see, remember, everything starts from your spinal cord. There are nerves going to your rectum, there are nerves going to your lower region, there are nerves going into your bladder. So if any injury is there, if there is some neurological reason, then also you can start getting constipation. Okay. And as I told you about traveler's constipation, very, very important point. Stress is also a very important factor in contribution, and age. Pregnancy also, you will see many people will be having pregnancy related constipation, unhealthy diet, and this is the way. So sometimes, you just correct your diet, you just correct your physical activity, you just correct your water intake, you just have some massage and things get sorted out. Okay. So again, what can be the possible symptoms? Let me just cover up the possible symptoms and the causes. So in case you are having fewer than less than three stools per week, that means there is insufficiency dietary fiber in your diet, or there is insufficiency of fluids. Okay. If you are straining ineffectively, this is one point, very, very important. That time you will strain. You will not know anything, but you do not know what is happening inside the rectum. I have told you that the rectum has stretch receptors. That is the way you get a call of nature. Because the stool comes lower down, it stretches, the rectum becomes bigger, it sends signals to your brain, and then you have to rush for an evacuation. So you have to understand you're harming those stretch receptors by straining too much. This is the main reason of piles, and this is the main reason of fissures. Now, what is a fissure? Fissure, as the name suggests, is a cut. Okay. Now, the fissures treatment will go on for 1 month, 2 months, 3 months. Suddenly, after 3 months also, if you're strained a little and then you've had in a lot of chili and spicy food, you will start getting burning in the anus region, because again, that fissure has opened up. Why do you think? See, now suppose I have a cut here, it will heal very fast. Why do you think this cut heals fast? Because on my soles and my palms, the keratin or the protein layer is very thick. God is very smart. These things we are using, the extremities for gripping, for working, the feet also. See, the sole of the feet is so thick. Suppose you get some cut also, it heals very fast rather than the skin here. This will heal fast. But remember, the mucous membrane inside is very thin. And it is an area wherein every day you will be injuring it by passing stool. That's why first thing they tell you is make your stool soft so that it slides through the fissure down. Okay, very important that you do not strain. At the end of the lecture, I will be telling you how to sit down. There are potty stools. I will be speaking about them. So this straining can occur if you have again lack of physical activity. Here, let me stress and explain what are hemorrhoids and what are piles. Because if I'm speaking of fissure, let me explain to you what are piles also. So piles is something, they are known as hemorrhoidal veins. Hemorrhoidal veins. Okay. So again, if you strain a lot, they start protruding in the form of grapes through the anus. There are two types. One are blind piles, which do not bleed, but then just because the vein has become very, very loose and lax, like I explained to you in varicose veins, dilatation, lengthening, and tortuosity. So the tortuosity se badle, they are forming grapes. So they can be blind piles. They will be just protruding from the anus, but not causing any problem. They can be symptomless. They can be painless. The other ones are bleeding piles and painful piles, because then the inflammation has started in the process in the piles. Okay. And inflammatory has 5 signs of inflammation: pain, the redness and all. These are very, very embarrassing because they are staining. They are staining your clothes, So it is better that Instead, now what people will do, they will, there are some quacks who, they tie up they say some thread you must take, some horses hair or something I've heard of, whatnot, and then they tie it and then it falls. But what you are doing is you're working on the external manifestation of constipation. Okay, you're working on the external manifestation, what has come as a consequence of constipation. So that's not a very great idea. That's a very transient idea. Work on changing your lifestyle, your sleeping habits, your waking habits. I explained to you what is the intestinal emptying time. Passing hard and dry stools can be because of travel, can be because of hospitalization, or can be because of changes in the routine of your lifestyle. Passing smaller than normal stools can be psychological distress, can be, example, abuse, depression, anxiety. So this is again like, they are not able to let go. So passing smaller than normal stools. Staining undergarments with watery seepage that pass around the hardened feces. I told you hard stool, around that the soft stool and there is seepage. There can be some functional impairment in the rectum and then the sacral area, some functional impairment, not a structural change. Feeling that the evacuation is incomplete. This is very, very, very common. In fact, we have a drug in homeopathy, it is known as Nux, always he will go, he comes out of the washroom, again he wants to go, because there is an unfinished sensation of the stool. There is an unfinished sensation that the evacuation is incomplete. This can be because of anorectal disorders. Maybe there is some disorder in the anus only which is not able to evacuate the stool, or there can be some infection, some disorder in the colon which is higher, okay, the larger intestine. Feeling bloated all the time can be because of thyroid disorders, can be because of diabetes, and because of endocrine or other metabolic disorders. Neurological disorders in Parkinson's, again, there can be side effects of a lot of medications. This also happens because of a lot of medications. Sometimes even habits. So here I would like to stress that if you will trace from where has my constipation started, how many years, so you will see that it usually starts at childhood. So here I always blame the mothers. The mothers sleep late, they wake up late, and then it's a little difficult to do things quickly, and the child has to reach, and the school bus, the time has come. So the mother tells the child to hurry. But these habits are formed in childhood. It is a good idea that you get up a little early. Give your child maybe some warm fluid, warm milk, okay? Or whatever the child is used to, maybe a breakfast, and then allow him 5 to 7 minutes on the pot. Then, if the child does not evacuate, do not force. Do not force. Maybe he will come back from school and evacuate. But I have seen many children rushing from school, and first they will fling their bag, their shoes, and they will go to the washroom because they do not like the toilet of the school. So here sometimes I blame the mothers because these habits are formed in childhood. So please give your child some time in the morning to sit on the pot, whether you get stool or no. Let it be like a routine to sit down there and evacuate. Okay, so there is some another entity also of, too much of calcium supplements. I think in 2 days back also, Ruchita, somebody mentioned too much of calcium she took and then she got some disease.
Yeah,
I don't remember. Somebody
somebody,
said, yes,
because there was plaque deposition because of calcium.
yes, lap deposition, I recollect. So even if you are taking too much of iron, then also you can get a little bit of constipation. So too much of supplementation is also bad. It is a good idea to consult your doctor, then taper. 2 months don't take, and then again you start. One another significant factor, if something you have tried and things are not working, can be out of balance gut bacteria. Okay, I have explained many times to you about the good gut bacteria and the bad gut bacteria, what happens, when the imbalance occurs. So you have to learn to shift. It's not a thing that you will be able to do it in one day. If you force yourself, you will not like your food only. So very gradually go, suppose you are having 2 cooked meals in a day. So what you could do is have one raw and one cooked meal. Go for a month. It's okay. Go for a month like this. Then change your diet. Nothing is going to, the good bacteria are not, it's not like a magic wand, it will be changed in one day. But go very slowly and try to get the healthier habits, which I do see you all are doing. Okay, so these are things. Now, sometimes the symptoms of constipation can also present as a heartburn, that acidity, okay, which I tell you, the stomach acids. It can also present as a regurg, acne, very, very important, acne. In young adults, young youth, they will be having a lot of acne because their sleeping timings are erratic, and again they miss that 4 to 6. Forget 4 to 6, they don't even wake up till 12 and 1. Okay, so acne can be as a result of that. Sometimes they are very, very formish, or they can have nausea. Dark circles, very important thing. You work with, you put your potatoes wedges and you put your cucumber slices, nothing works because you're constipated. First, work on the internal body. Now, sometimes you complain, or the patient comes and complains of a lot of low lumbar back pain region, in that region. You will work on everything again. You've done this exercise, you've done that exercise, but you forget to ask about constipation. So always ask, whether in whichever line of treatment you are doing, physiotherapy, yoga, whatever, always first rule out constipation. And is the pain because of a referred pain? What is a referred pain? Bowels are constipated, but I'm getting pain in the kidney region. Bowels are constipated, but I'm getting pain in the low lumbar region. Is it that way? That all you must rule out. Okay. And never ever strain. Sometimes loss of appetite can also occur. So, what can be the chronic complications of chronic constipation? There can be fecal impaction. What happens is the feces become so dry that they go and stick on the intestine, and then if that area, the stool portion becomes bigger, it will again lead to blockages. This happens usually in the elderly adults who are hospitalized. Okay, and there can be intestinal obstruction, or there can be intestinal volvulus, which is one intestine pieces goes over the other. It just overlaps. That's a dangerous situation. Sometimes happens in children, and children die also because of this. Intestinal volvulus is the intestine overlaps over the other intestine, and it's a medical emergency. Okay, because one day you'll think, okay, stool, child has not passed. Maybe second day he will pass stool. No, that is an volvulus. Okay, and there can be urinary and fecal incontinence. Incontinence, there is dribbling, or there can be sometimes the stool gets so hard that it can even rupture your bowel. It can rupture your bowel, and this all can be lead to risk of colorectal cancers. Okay, so important this is. So how do we manage it? So as I told you, the stool structure also indicates, so I'll just read it out to you. So if there are separate, hard, lumpy kind of stools, then that is severe constipation because there is absolutely no water in the stool. Then they can be lumpy, then that is mild constipation. They can be like a sausage shape, but there are cracks in the center, which is a normal stool. Okay, it should be shaped like that. Sometimes it is very smooth like and like a snake, that is also again normal. Okay, now there are very soft blobs with clear cut edges, that is lacking fiber. Fiber gives you very, very erratic, the roughage kind of thing should be seen in the stool. Now, if there is mushy kind of thing but with ragged edges, then again that is mild diarrhea. And if there is liquid consistency of the stool with absolutely no solid particles, then that is severe diarrhea. Severe diarrhea, you can get a little dehydrated, so replenish with fluid. So now what happens is when we sit on the pot, usually our knees are higher than the hips. Okay, no, if you sit like this, maybe the knees are in line with the hips. So now what you have to do is you have to take, there is something known as a potty stool. In case you do not want to invest in the potty stool, what you can do is take your foot resting kind of a stool. Okay, keep it in the washroom only, and when you are sitting on the English style pot, what you can do is keep your knees higher than the hips. In this area, keep your knees higher than the hips. You keep your feet on that stool and lean forward. Why lean forward? Because that's the way you will be applying a little pressure to your abdomen. And put the elbows on your knees. Okay, put the elbows on your knees. There will be gentle pressure on the abdominal region. Now, in this position, what you have to do is bulge out the stomach. Get your tummy out, and then in this position, apply a little pressure to the abdomen. I'm not saying apply pressure to the anal region. And it is important that you should not slouch, because again, the intestines will bend. You have to sit straight. Your spine has to be straight, but you have to bend a little forward, bloat your abdominal area, and then what you will do is apply pressure to the abdominal area by bending forward, keeping your elbows on the knees. So this is usually the best way, because in this position, the stool is facilitated to come out from the from the rectum region. Okay, and it is seen that women suffer more from constipation. This can be because of the slower movement of food through a woman's intestines, as well as the effects of the female hormones which they have on the gastrointestinal tract. So this tool is a good investment. How do you think we can manage it in other ways? So we can increase the fiber intake, as I told you in the morning. Dietary fiber, it will not just happen in just a day. Okay, and what the dietary fiber is going to do, it will increase the size of your stools. It will make it softer and easier to pass. And say around in the males, you can have 38 grams of fiber increased, and in females 25 grams will do good. Now what happens is, suppose you listen to my class and then you say, no, now so I'm going to have only fiber. So remember, if you have too much of fiber, that can also cause bloating. It can cause a lot of gas and flatus, and it can also cause constipation. So don't overdo fiber also. Okay, but this will help, because I have always told you that fiber is also a carbohydrate, but fiber is considered as a good carbohydrate. Okay, because the good gut bacteria in your large intestine, their food is fiber. So they will eat fiber, they will multiply. Okay, so that's a good idea to be taking fiber, and the best position is that you have it. The best time is that you have it in the morning time. Now, a little bit about that, which we sit properly in the 90 degrees hip angle. That what does it do? It disrupts the passage of your intestines, making the bowel movement a little difficult. When you raise your knees a little higher, 35 degrees, the hip angle becomes 35 degrees. What does it do? It does not constrict your rectum. Otherwise, in this position, the rectum gets closed. Whereas if you take that potty stool, then the rectum becomes more opened up, and you can evacuate much more smoothly and easily. Okay, so I would like to say here that eyes are our window to the soul. Our poop is our window to our health. Look through it, look at it, and listen to what it is trying to tell you. And there are certain foods. So I always tell my patients that what you do is you soak 2 dried figs, 5 to 7 black raisins in the night. Wash them 3-4 times and soak them in that water. Cover it up, and in the morning on empty stomach, you should be chewing those and having that water also. Right? Then you can go in for your glass of warm water with a little lemon, not for the purpose of weight loss. I don't believe in that. Doesn't happen. But then the warm water will push the stools a little down. The best exercise during this time to be done is, what you do is, after you have had your figs and your warm water, extend up like this. And then bend to your right side.
Divya, we can't see it.
Yes. So extend, go on your toes, extend to this side. It's very simple. You don't need to even extend to this side, back side, go down, touch your knees or a little lower. And then these 4 movements have to be done, because they will facilitate the water which you have had to go in the corners of the intestines. Corners of the intestines, once the water is gone, it will release the stool which is impacted on the intestine, and then you go for your bowel movement. In case you do not have a stool, you do not have Indian toilet, you have English toilet also. There are some people who sit in Indian style on the pot, because that is again A great idea. You will see the maids and everybody, they will have normal deliveries always. They will not complain of constipation. They can even squat on the floor and sit very, very easily. It's all because we have become, these are the problems of urbanization. No new building will be having an Indian toilet. Okay. So the foods which can relieve constipation are prunes, kiwi.
All due to our knee pain, madam.
Yes, madam. So the body stool is a great idea. That will not work on your knee pain also, and it will not even work on your constipation. It will not happen. The stool is a good idea. Sit on the English toilet, but keep your feet raised. Okay, figs are great, artichokes are great, and legumes. Legumes also cause a little bit of that sliminess. So they are also very, very essential. Pears as well as citrus fruits help in it. Okay, so there are many, many, many ways you can manage it, through this. Then the other way which I told you was that you need to really, really move. Movement is medicine. And some form of exercise should be there. You will only realize that today I have not moved, my bowels are not giving me a great stool. Okay. And fluid intake also very, very important. And another thing which works very well is your amla. Okay, this is really tried and tested. Now, amla is something which, if you have it in whichever form, it helps. In whichever form, it will help you. So you can have a little bit of take 2 amlas, de-seed them, and just remove little juice out of that amla. And all this has to be done before 12 p.m. On waking, if you do all this, 2-3 days, maybe you have 2-3 more bowel movements, but then it will be set. It will become set. Okay, and after that you can have your, you can even add your amlas to your smoothie, your green smoothie. You all have green smoothies, right? Jimmy, are you able to follow what a smoothie is? Diana? And then you really, after a green smoothie with a little amla, with a little bit of cinnamon, with a little bit of black pepper, you can really, really facilitate your bowel movement. And then by 12 p.m., you can have your brunch or lunch or whatever. Yeah, Jyoti madam, you were saying something, no? Jyoti madam, you wanted to say about the position? Any quick question you all have? I don't mind taking questions. Yes. Dinah, amla is gooseberry, the green one, small. Amla is one thing where the vitamin C does not get destroyed even if you make as a murabba, even if you heat it, even if you boil it, the vitamin C remains intact. Ruchita, even kusum C is new to our class, no?
Kusum C is new.
You said a what now? Alum?
Yes, ma'am.
What is the name of it?
Dinah,
What is the name?
amla. Amla is gooseberry. Gooseberry.
Oh, okay.
Ha. Yes, Gurvinder madam. I just need to speak about Isabgul also. I'll take it after the
Okay. I just wanted to ask, like, immediately after having the water, we can do the exercise.
After the water only you have to do the exercise.
Immediately after having the water.
Immediately bend right with
No, that's
extended. Okay. And then back and front, you can do it twice. But then you will feel the little stool has come lower.
thank you. Thank you.
Or do it in the washroom before the pot. Yeah.
Thank you.
Very, very, very important to get a good, it has been said that the man of the house, he did not have a good evacuation. He shouted at the wife shouted at the child goes and bullies somebody else. The proper bowel movement in the morning is so, so important. In fact, it may sound very absurd and very, very funny, but then we do weigh our stools. Don't we weigh our stools? Imaginary? Don't we weigh our stools? Don't we feel happy if I have had a good evacuation? We certainly feel light. We certainly feel light. Oh, today I had a good stool, I'm feeling light. And then we feel like eating. If we've not evacuated, we don't feel like eating. We feel there's dirt inside. How can I add more food? It's not a great idea. I will be burdening my system. So stool is so very important. Similar to food, I think this is more important. What if you absorb? What if you assimilate, but you can't excrete? You're eating the best of the organic foods and everything, but you're not able to evacuate things. Isn't that a great, this thing, a no-no? Okay, so I'll just speak about isabgol now. There is something known as Ruchita, PHY, phylum husk. या xylem husk वो डाल दे chat में. So that it is a xylem plant husk. Okay, that is something known as isabgol. Now the general tendency of people is that before sleeping they will take isabgol and they will just mix it in a little bit of a glass of water. Have that glass of water. Some of my patients even mix it with a cold drink, a sharbat, and then they will have and sleep. And then they say isabgol doesn't do a great job. Okay, so the wrong thing you are doing is that isabgol is supposed to absorb a lot of water and become its fiber. It's fiber. Okay, but what you are doing is it is going and absorbing water in your stomach. So don't you think it will make it more dry? It will make it more dry. So the good idea is that you take a little quantity. Now in the night, maybe you all are having 1 spoon. That is not required. Just maybe half spoon or little lesser than half spoon and a little more than 1/4 teaspoon in a small container. Soak it in the afternoon or 12 o'clock or morning. Warm days don't soak very early because then it gets a little rancid. Say around 12ish, 1 o'clock, soak it. Then in the night, it will become swollen up and it will become very, very gelatinous. It's not a great sight to look at, but then you'll have to take a spoon and get it out from the sides of the container. After that, you have that and have maybe 1 to 2 glasses of water. So if you feel, if I have 1 to 2 glasses before sleeping, then I'll be visiting the washroom so many times in the night. So it's a great idea that you have your dinner early. Post dinner, maybe around 8ish, have that isabgol, have 2 glasses of water, and then you sleep by 11. Because with isabgol, it is mandatory, compulsory that you have water. Otherwise, that same isabgol can cause constipation. There are people who will tell you, isabgol, no, you must take in milk if you have constipation, and if you have diarrhea, you must take in curd. No, both are wrong. Irrespective of milk or curd, it has to be soaked for a longer time externally outside your body. And then you see how that isabgol works. So these are real valuable tips and tricks which I'm sharing with you. Hi, Kamala Tirani.
हाय ये सब गोल के लिए तो बोलते सूप में भी डाल सकते हैं, दाल में डाल सकते हैं, चपाती में आटे में बना सकते हैं.
लेकिन उसको सूजने दो, उसको स्वेल अप होने दो. वो उधर ही दाल में डाला और दाल पी लिया, नो. आई बात समझ में? मंजू अग्रवाल.
Yes, madam. Yes, yes.
सेना के पत्ते के लिए भी लिखा है कि बहुत साइड इफेक्ट है, लीवर डैमेज होता है, डिहाइड्रेट होती है बॉडी, और 1 हफ्ते से 2 हफ्ते से ज्यादा कभी लेना नहीं चाहिए उसको.
That's why you must resort to your natural remedies, and they work. See, if I tell you isabgol, it will not work in one day. It is not magic. But then it has to be a lifestyle change. आप करके तो देखो, 1 week, 2 weeks में you will see considerable difference. But if you are simultaneously having only the white carbs, the breads and everything, you know, because of a healthy lifestyle, your hand will not go towards those things. You will have a treat, maybe a pizza once a week. We do like it. But then the lightness which comes after eating these kinds of foods propels you or encourages you to follow that lifestyle. Followed, Bakula ma'am? So you don't have to be convinced with anybody. Your body only tells you, look, I'm feeling nice. JK क्या बोलते हैं? So what madam said was senna are leaves. Okay, I think they are also called sonamukhi. So be leaves. Son patta, something like that. हाँ JK. Yes, Sunil D.
Yeah, ma'am, I just wanted to ask you one question. I have 3-4 days a week. I have very hard stool in the beginning, very difficult to pass. And then after 1 hour or so, I have second motion, which is normal. Why is it so?
What did we see in those? What did I tell you about the hard stool? Is again some inactivity in the rectal region. So what you must do, practice your Kegel exercises. Take a tub of water, sit in that tub of water, take potassium permanganate, that pink color ka mercury chrome. No? When we used to fall,
Right.
children used to come with red color dawai. Like that, you do anus contractions, release. So water will also go inside the anus.
Okay.
Oh, and do again and again anus contractions and all. And are you on any laxative?
Not very frequently. I have to take just once a week or so. I take plenty of water. I do exercise also, but one problem is I have diverticulosis problem also.
So this is
So,
the main thing which you mentioned now. So it is
Yeah.
okay. Now what you can do is, when you are sitting on the pot, with your hands, you can little bit enlarge your anus. Just pull the, but how we sit in yoga positions, no? Being very honest, I have seen many people never ever insert the, there are many people who do that. See, we are all seniors, we can discuss it out here, but then that gets very habit formed. So what you can do is with just pull the buttock flesh apart, increase the aperture of your anus and see if you get a good stool. Or again, the good idea is hold always near your commode. You should be having handles. You can sit on the pot. That's a great idea if you have support. And be very confident that you don't slip from the pot. Huh?
No, I use a stool. I use a stool to keep my legs up.
So increase the height of the stool. Keep something below that also. Keep a block or a brick or something like that. See, you have to do a lot of adjustments rather than going and taking laxatives. Understand the disease first. Many things do not need treatment. Do not need, like, my friend, she told me, I was taking her mother-in-law, her husband and her case. She told me, Divya, हमारे घर में तो candid तो डजनों के हिसाब से आती है. Candid powder, dozens. What? This is not synthol powder. These are medicated powders. What is candid? It is fungal infection. So just imagine you're making your skin resistant to fight any disease. It will depend only on that candid. Now another patient said Zol. Zol comes in, Zol is an antifungal ointment because they get a lot of rash in the private parts, in the groin region. You are not allowing that skin to breathe. You're wearing the pant the whole day. Okay, you should allow that skin to breathe. Even under the breast, they will have intertrigo. What is intertrigo? Is that people who are very heavy or in the armpits, the sweat, it accumulates in those areas and their sweat is very acrid. What is the meaning of acrid, Diana? The sweat only causes all these boils. Yes, the sweat causes because the sweat is very acrid. So you need to keep wiping that sweat. It's not a great idea to have 10 times in a day bath because water again feeds those bacteria. Wipe that area dry with a soft linen muslin cloth. Malmal ka kapda.
But sometimes we get the rashes on the hands and feet also, or on like arms and legs,
That
or
is,
on the stomach.
I am speaking of this the pasine wala, Gurvinder madam. That is again maybe sun exposure, maybe your detergent exposure, maybe eczema. It can come anywhere. So many. Yesterday we had a nice thing on manifestations of dermatological disorders in diseases. Ek webinar.
Okay.
Which disease can prevent as what skin disorder? How to recognize? That is there, but I am speaking of this also because we spoke of candid, na? Kitna Jimmy, are you able to follow? Is it making any sense? The class? Rajni Mehta?
Sorry to say this, Divya. Climatic conditions cause sometimes, the foreigners are having that kind of constipation always.
Climatic conditions can cause. Climatic conditions can cause, change of climate can also cause, madam. Change of climate is pakka to cause. See, now they will cause viral disorders and everything. So what we should understand is that constipation should be considered as a symptom and not as a disease. It is a symptom of something else. Remember what example I told you? Migraine, you're taking medication, but inside there is some tumor. So finish that causative factor. These are manifestations of that cause. It is commonly in the elderly and in nursing home residents. Many options for prevention and treatment. The choice should be tailored according to each individual person. So understand the constitution of the person and then do it, and talk to the healthcare provider if constipation lasts for more than a week. And you can also attend classes from the lounge. Click on explore option to see other good options. Classes on the
You're not sharing the screen.
Oh, I'm not sharing. Oh, I'm
No.
sorry. I'm sorry. Thank you for reminding me. 1 second. Just give me a minute. Yes, these are takeaways are also very, very important. One second. Huh? Good, you all told me. So I'll read the summary again. So constipation should be considered as a symptom and not as a disease. And common in the elderly and the nursing homes residents. Many options for prevention and treatment. Choice should be according to each individual patient. Okay. So as I always tell them, ready-made clothes, little will fall, the shoulders will fall. But if you have tailored clothes, it will fit you to the T. So like that, even the healthcare provider should be considering all the factors, and then like how madam mentioned, Sunil did that, I have diverticulitis, that's why. Okay, in the end she mentioned, first she told me the presentation like that. So we have to take a case history and understand why it's happening. So this is the way you can attend through lounge, on click on explore option and check your mail and give feedbacks, share your experiences on the social media platform, tag Getsetup and tag me too, and you can also send your testimonials to help@getsetup.io. Okay, any other short quick question? I do not mind taking. We are on time. Dot 16. 17. Dinah, did the lecture make any sense? Yes, she's mentioning. Thank you, thank you. Yes, Kanaklata. Thank you, Sunil madam. So we meet on Monday for a camp. 10 o'clock we don't have sessions. So Monday, yes, Kanaklata. Okay. Thank you for that heart, JK. Bye-bye. And thank you, Ruchita, for always being there. Oh God, so many hearts. Thank you, Rajni Mehta. Bye-bye. Okay, bye-bye, ma'am. We'll meet on Monday for another camp. I think we are starting with diabetes camp, so that's really important. Thank you, Anu Bhatia. Anuradha Mathur again, thank you. Bye-bye.
Bye.
Thank you for the gift of your time, energy, and attention. Bye-bye.